practice emotional awareness and boundaries. So this goes together, right? Emotional awareness and communicating boundaries. You really have to have both together. So what this means is you have to be able to identify and articulate your emotions accurately instead of just your thoughts that are disguised as emotions. When you say, I feel disregarded or I feel rejected, that's an interpretation. It's not an emotion. So having that distinction is going to turbocharge this. But you have to understand, well, what am I actually feeling? What am I reacting to? What meaning am I giving this? And then understanding your own personal triggers and knowing what your areas of sensitivity are will allow you to decide what's okay for you and what's not okay for you. What are your boundaries that you can implement to prevent unnecessary escalation? For example, if you know that you have an area of sensitivity around feedback in a certain area and you know that you can get triggered, you can let your spouse know when you bring this feedback to me, it's important that you lead with an I statement. It's okay and I can hear you and I'll receive your feedback if you lead with an I statement and not blame and criticism. But if you lead with blame and criticism, I won't be able to continue the conversation because I will get too escalated. So that's an example of how your emotional awareness of what's going on for you and your sensitivities can give you some clues as to what your boundaries need to be and to be able to just stand up for yourself in that way. It's not a sign of weakness if you have an area of sensitivity and if you have a need or a boundary around that. That's what relational is. Your partner might be like, well, you shouldn't need that, but that's not really their place to say. And sometimes we judge ourselves and say, I want to be able to transcend this area of sensitivity. But if you know that that's a trigger, it's really okay to say, here's what's okay and here's what's not okay. So when you're communicating and you feel like you're entering into dicey territory, there's two things actually that you could do to support you in this emotional awareness and boundary setting. One is to just be really curious and open, replace assumptions with curiosity. Like if they bring something up to you about how they're feeling and maybe they're missing the mark in how they're describing their emotions or you don't really get it, you can just say, can you say more about what came up for you around that? Like, what does that mean to you? Say more about how that made you feel instead of reacting defensively. And then, of course, doing that for them too, or vice versa. You want it to go both ways, obviously. And then the other thing you can do to support this one is to build emotional intelligence, which basically means you're developing a vocabulary around emotion words. You are well versed in what your own triggers are, and you have the words for it. You know how to say it. This sounds really obvious for people that have been in therapy a long time, but if you haven't done that and you haven't done your own work, and if you were raised in such a way where bringing up emotions was not encouraged, and in fact, it was frowned upon, a lot of times people, especially in my generation or older, don't even know what they're feeling. You can download the emotions wheel, Google the emotions wheel, download it, look at it. There's not that many core emotions, but there's a lot of offshoots of those core emotions. And sometimes looking at that can help you identify.